Hi, this is Matt Breton, physical therapist at Northern Physical Therapy again, talking to you about pain and understanding your pain. This episode I want to talk about persistent pain, which is a lot of what we deal with here in physical therapy. People come in and they've had pain for even beyond 3 months, 6 months, 2 years, 20 years, and it causes a lot of changes in someone's body that are really hard to overcome. Persistent pain can increase the sensitivity of your nervous system so that every sensation begins to get read as painful. That's both within the peripheral nervous system, the stuff in your limbs, as well as in the central nervous system, your spinal cord and brain. Those changes in your brain can include an expectation of pain, even when there's not a nociceptive signal. That nociceptive signal comes from the periphery. Even if there's no signal there, the brain still feels pain. The sharpest example of that I'm aware of and that I like to talk about is something called phantom limb pain. This is the pain some amputees feel in a limb that they no longer have. So they are missing a foot or a hand, and they will feel pain in that hand. In a brain where that occurs, almost anything is possible. So I'm not saying that persistent pain is all in your head. There's often a peripheral source that we need to deal with in terms of a signal, but that pain has a large source in your brain that needs to be considered and thought about. That sort of persistent pain can cause something that we call fear avoidance behaviors. And what happens there is someone who's been in pain for a long time is afraid to do the very things that might help them get better. And so what we need to do is find those safe ways for people to move in physical therapy that get you around that fear avoidance. So if you have persistent pain, you need a very strategical approach in dealing with it to help in that situation.